display, right? Same unit. And this one is same
Okay.
display, but this will come in color.
Okay. Like this.
Yes, sir.
This will be black and white and this will
Yeah. This will be inbuilt battery.
Okay.
You can charge it also in additive limit.
Okay.
And also,
What about this one charging? Just by
Just-
adapter?
just-
this is regular
9 volt battery.
Normal battery.
Normal 9 volt battery, Duracell
Give
battery.
you rechargeable battery also, that you have to charge it outside.
Okay.
Charger and one we will give you. And then there is another model, this one.
Okay.
Same thing like this one, black and white, data, sound, and inbuilt printer.
Inbuilt printer.
So you can immediately get the printing in the theater. All this except this one, all others you can get printed
Okay.
through computer.
Okay.
This is the largest model. The specialty is you can use 0.8 mm probe,
Okay.
which is thinnest probe, which can be used to even guide the blood flow in the branch arteries.
Okay.
And this is the one in all India Institute of Medical Science, NIMS, big institutions buy this. And we have all over.
Cutting the probe.
The probe is you can sterilize it using steroid and
ETO.
ETO
Yes,
plasma.
ETO.
will come minimum 50 times.
Okay.
Then you have to buy one. Some people use it even after.
Just only this part only you buy it. This is after that you use this.
This is the amplifier.
Okay.
So it will all come in one package. When you buy, you have the unit, you have the amplifier, interoperability, and a probe for external use. In the OP, you can use it. A regular probe. When you use a regular probe, you
For
can even
carotid
find the And we also give you, here you will notice we give you RP values. The values. RP. This is a resistance parameter. So this is for carotid artery. If RP is 0.75,
Okay.
so this comes free almost when you buy it.
All
You
this
have an external one, and you can for cerebral vascular. Also, like if you add 2 magnets flat probe, you can use it as a precordial Doppler, which is used in implants,
Yeah, I
AIMS,
understand.
and Ruby Hospital. You can monitor, sitting craniotomy procedure.
Okay. Understood. Now about the cost of this?
Cost is, if you want to